have a great depth of volume here. We're a level 1 trauma center. We also have our freestanding children's hospital. And our adult population, we treat all sorts of elective cases from bariatrics to transplant to surgical oncology.
One of the crown jewels of the program is the clinical volume that we have. I think that it's safe to say that we are easily the best clinical training program in the state of Virginia. Our residents will rotate, but they'll also do clinical rotations at the VA hospital, which is just a few miles down the road.
We do bread and butter general surgery with our acute care services, and then we do the super specialized pediatrics or oncology, transplant, all of those. So it's a great variety.
Again, our residents have the chance to do 2 years optional in the lab. About half of them will do that. They will do research either in basic science. They do research in quality improvement work at the VA.
At an academic institution like this, research actually is very important in the surgery world. Our residents here have a couple of options. We participate in research throughout our entire training. So we can do projects that are clinically related to the patients that we're taking care of.
The academic time that the residents do positions them well when they move on to apply for fellowship at the completion of this program.
In surgery, teamwork is absolutely essential. No one can ever do surgeries by themselves. It requires a lot of people's involvement, the nursing staff, the scrub techs, the anesthesiologists, obviously yourself attending. And so really to make surgery work, you need a lot of people involved and a lot of people on the same page. And from my own experience, I've had a great experience of working with others, both in the OR and outside of the OR. People are respectful and people listen to each other and communicate clearly.
We have state-of-the-art equipment, from our laparoscopic equipment, our robotic equipment. The rooms in general, are beautiful, and it allows a more cohesive environment in the operating room.
All the faculty here are very supportive of their residents, and they have the means necessary to support them, because a lot of times at this point in your career, it comes down to how you interact with people and who knows you and who doesn't know you.
The program has your best interests at heart, and I don't think that's true for all surgical programs, especially, historically we get a bad rap, and this department is so supportive and so helpful. You get an amazing training, and Richmond is such a fun city to live in. I think all of those things kind of wrapped into one makes it a really nice option.
The people in the city are exceptionally nice. There's a lot of history in this town, and there's very good places to go out, eat, or just hang out by the river. It's definitely an easy place to be when you're not working, but it's also a place that's very well connected.
We're constantly evolving and adapting, and we're always open to change and making things better.